Okay, so we'll talk briefly about pediatric medication administration. You all know about pharmacokinetics. In children, some things that are different. Organ system immaturity affects drug sensitivity. So pediatric doses are calculated based upon body weight or body surface area, and we'll learn how to do that calculation in this class. Children's basic metabolic rate is faster than adults, so drugs may be metabolized more quickly. Children's livers are not fully developed, so if a drug is metabolized by a liver, children reach toxic levels much more quickly. For excretion, metabolites that are eliminated by the renal system, limited amounts should be used until about 12 months of age, because 12 months is when kidney function is mature in children. So anything that's metabolized by the kidneys needs to be used with caution prior to 12 months of age. We'll do a pediatric math activity together so you all know how to calculate body surface area. Pediatric medication administration. Again, immature livers, which may lead to children to experience exaggerated side effects or unique side effects. Remember to educate parents to never leave medications where children can get them and not to take the meds in front of their children. Don't encourage medication administration by acting like the med is candy, because this may lead to an overdose later if the kid thinks they're eating candy. I know you all are aware of the 6 rights of safe medication administration. To verify that you have the right child, you can use their armband and ask the parent if the parent is in the room. Routes. Oral is the preferred medication route for children. Make sure to never give an oral medication while the child is lying flat. It's best to put liquid forms in the side of the mouth to help prevent aspiration and to give it slowly. You can give rewards to preschoolers and early school age children for taking their medicines. Be honest about the taste of medication, because we don't want to lie. For liquid medication, place in the smallest container for preschoolers or younger, so they'll receive it as less medicine than if you put it in a taller container. Rectal is the least desirable route for pediatric medication administration. It's good if the child's unconscious. Make sure you apply lubricant before inserting it. For infants, insert a 1/2 inch or as far up as the first knuckle on your little finger. For an older child, insert 1 inch or as far up as the first knuckle of the index finger, and then hold the buttocks together. For IM injection in children, infants use the vastus lateralis, such as when we gave the vitamin K. For older children, you can use the ventral gluteal. Here's a picture for infants, making sure that you're using the vastus lateralis. And then for older, you can use the ventral gluteal. ATI had a nice video for these medication administrations in children, and they have taken it down. So I have emailed them, and if they get it back up, I will let you know that. We'll talk about how to calculate fluid rates when we talk about dehydration in children. Just remember, the oral route of rehydration is preferred over the IV route. For venous access in children, consider the dorsal surface of the hand or flexor surface of the wrist. Consider leg and foot veins and scalp veins. And remember to cover the IV site and use an arm board if it's in the arm. For children, make sure you flush peripheral IVs every 2 hours. That differs from your adult recommendations, and that's just because you have to use smaller catheters. They have smaller veins, and they a lot of times will clot more easily. This is a good story. If you click on the link, I'll let you do it in your own time, about a child that received the wrong medication and died from it. And then there's some discussion questions listed in the notes of your PowerPoint slide that you could answer about how it could have been prevented. So to kind of hit home the fact that medication administration safety is important with everyone, and especially in children.